On today's Two on Your Side Town Hall, hospital workers on strike. We're going to be digging into the impact of the walk-off, not just for the workers, the hospital and its patients, but really for our entire region, and talk about the national shortage among healthcare workers. Plus, a pill to treat COVID, a possible new breakthrough in the fight against the coronavirus today. We have a great expert who will answer some questions. What are we to make of it? And the Buffalo Bills are certainly on a roll. Will that continue against the Texans? We hope so, because they're not very good. Our Channel 2 Bills insider Vic Carucci will join us like he does every Friday to get you ready for Sunday. We're glad you're here with us today. Right now, nearly 2,000 workers at Mercy Hospital in South Buffalo are in their 11th hour of a strike that started during this morning's shift change. We've reported on the sticking points for negotiations between Catholic Health and the CWA union. Here in the town hall tonight, we want to start by looking at the impact of the impasse. So ahead of the strike, Catholic Health already reduced some services at Mercy. A couple of days ago, ambulance started getting diverted from the hospital and its Ambulatory Care Center, and the hospital suspended inpatient elective surgeries. That was Wednesday. Well, now that the strike is underway, some patients are now instead being taken to other Catholic Health hospitals or Kaleida facilities or ECMC. Channel 2's Dave McKinley joins me live right now from Buffalo General. And Dave, I know a pretty active scene there for part of today. We're a half day into this and already some big changes to kind of health care generally in the region beyond just those immediately connected to the labor dispute.
Yeah, well, you can call it the trickle-down effect, Michael. It is something that other local hospital systems fully expected and indeed began seeing a couple of days ago when Mercy Hospital started constricting those services that you mentioned at the top of the show, meaning patients in need of those types of care either had to go to other Catholic Health hospitals or other hospitals entirely, like Buffalo General, where I am standing right now. They tell us here that they are indeed busier, noticeably so, but so far things are manageable. However, behind me, take a look right back here, they are preparing to see if there is going to be an overflow situation. Tents being set up like this one outside Buffalo General where patients could be treated if need be. We're also told they have a tent like this, at least one of them, at Millard Fillmore Suburban, with ambulances being diverted from Mercy. Emergency rooms at this and other places like ECMC are getting busier, and therefore you can expect some longer wait times if you were to arrive at emergency room there. Now, to curb this, hospitals are urging those in need of medical care where appropriate to try an urgent care center instead. But if everyone follows that advice, you could expect those places to get busier right quick as well, Michael.
Yeah, you called it the trickle-down effect, no doubt, Dave. We've also heard in all of this from both sides about the staffing shortages. We know that's a major sticking point in the negotiations. I want you and our viewers to listen to what a union leader told you about the staffing problem.
The biggest issue for us on the table right now is staffing, and that is key, not just for nurses, but for nurses' aides, ITAs, unit secretaries, and then all of our therapists and even our service employees that work really hard to keep the hospital clean and get food to the patients.
And Dave, it certainly is a fair point, but this is not specific to our region. I'm not sure there's a hospital in America that couldn't use more nurses, more technical and service staff. The shortage, though, is especially acute among RNs, and it really is throughout the whole country, right?
Well, certainly in some parts of it, Michael. Now, when this labor dispute began to turn thornier in recent weeks, we heard from the union their biggest grievance was a shortage of staff. We heard from Catholic Health that they have been hiring additional staff. They have been trying to hire more, but trained medical professionals are getting harder and harder to come by. Here's some statistics to take a look at where things stand, like a study from the American College of Medical Quality that found by the end of the decade, the U.S. is going to be short more than 500,000 registered nurses. Why? Well, a third of the existing nurses are baby boomers. They're going to be retiring. Also, our aging population in need of more registered nurses and other healthcare workers. Also, a shortage of nursing professors. So that means There's not enough people to train those who are seeking to go to college and get into the nursing profession. And then, of course, you can't have enough of those. You can't have enough getting out of school and taking those jobs. And the schools, of course, in a hard place because if they don't have the professors to teach the kids, there's only so many slots available. Plus, we have to add in that a lot of nurses are moving out of the field. And, of course, the pandemic is said to have worsened that situation, Mike.
Yeah, Dave, before we run out of time here, I want to address something that I think everybody is asking right now, which is when will this strike end? At the moment, the two sides are not negotiating. This is what Catholic Health CEO and President Mark Sullivan said this afternoon.
We are in the middle of working with the Department of Health. We're in the middle of stabilizing the staff here at this facility and the other Mercy Hospital facilities. And we want to be back at the table, but our number one priority that was thrusted upon us is to ensure we have safe patient care at Mercy. And that's a priority of everyone at Catholic Health today. And we want to, as I said this morning, get back to the negotiations.
The union said this morning no negotiating this weekend, but that may change. Dave, we got about 30 seconds left. What is the latest on how long this is going to last?
Well, the union said its negotiators needed a break after 18 straight days of marathon sessions. However, federal mediators, as we understand it, are involved, and the union says if they order the sides back to the table, they won't hesitate to get there. As this stews, though, Michael, you have to think, though, this could result in increased pressure on Catholic Health, especially if the loved ones of patients, not the union members, but the loved ones of patients, start raising concerns of their own should they feel that the care being given their relatives at Mercy, for example, are slipping due to the absence of those now striking workers.
Channel 2's Dave McKinley, who will also have a live report next at 6 o'clock, along with our Ron Plants with the union and our Steve Brown with Catholic Health. So more to come on that, Dave. Thank you.